You're welcome back. You're watching Firecrackers, and we are live from our studios here in Lagos, Nigeria. Now let's cross over live to Calabar, the Cross River State capital, where we have Dr. Betta Edu standing by, the Commissioner for Health in that state. Doctor, if you can hear me loud and clear, thank you so much for joining us on the show tonight. We haven't spoken to you in a while, so I guess congratulations are in order for you. You have been appointed as the chairperson of the Commissioner of Health Forum in Nigeria.
Thank you so much for having me.
Okay, now, let's give us a few, first of all, about your first meeting. We understand the Minister of Health was present, Dr. Osage Hanire. Tell us some of the takeaways from that meeting.
I think one of the sectors in Nigeria that has been really hit by the COVID-19, or the sector that has been at the forefront of COVID-19, is actually the health sector. And of course, we had to come together as gladiators in the health sector and see how we can push forward in spite of all the challenges that face us on a daily basis. The leaders in the health sector met on Tuesday in Lagos, and we met to discuss issues that is affecting the health system. Of course, you would expect on the front burner is the issue of COVID-19. The minister brought up certain challenges with COVID-19. The fact that testing was going down. Less people are being tested every day, and so we are unable to meet the 2.5 million target over 6 months, which we had. They brought up the issue of having samples collection centers across the various local governments in Nigeria. He also spoke about the issue of labeling of the samples collected from people, which was wrongly done, and so it will lead to discarding of those samples. A lot of other things were discussed around the same 1 million life, the Basic Healthcare Provision Fund, which is supposed to be released to Nigeria to basically stimulate the health sector and provide healthcare services, as well as help Nigeria achieve universal health coverage. So there was a lot of discussions around that. We also had the House Committee Chairman on Health present at that meeting, and then we had all the commissioners for health join, both physically and virtually, in that meeting. It was a very great deliberation amongst everyone.
I'm just a bit concerned. I know you're part of this government, but tell us, government at all levels, at the federal and at the state level, do you think we have actually learned from the COVID-19 pandemic?
Still yet to be unsaid. First and foremost, everybody believed and wished that the Nigerian government, and indeed governments of the various states, would actually use the window of the COVID-19 to fix the health system and make the health system more resilient to be able to respond to any other disease or pandemic that might come out in future, and even those who are present with us right now. Unfortunately, that's not the case. We have seen a lot of fatigue across board. Up until now, we're yet to get the funding which was promised by the PTF to states. I think only 4 states have received fundings up until now from the federal government of Nigeria. The Basic Healthcare Provision Fund has not been fully implemented across states. And so we have some very critical basic challenges in the health sector that needs to be addressed. And this is one of the reasons why some of the reasons why we met to discuss as a group, to discuss as leaders in the health sector, and chart a way forward for, of course, the health sector.
Before we begin to wind down, Dr. Betta, it was first the Madagascar syrup, and then it's a vaccine from Russia for the COVID-19. What's your take about the vaccine? I mean, We hear it has some serious side effects, but then it's in Nigeria.
Well, for me, I think we're not ripe yet. And we need to do some due diligence before we take up those vaccines and issue them to Nigerians for the purpose of public safety. We need to be sure of what we are giving out to people. We need to be sure of what we are going to expose the population to. It's very, very important. I think first and foremost, the government needs to slow down. The government at the center needs to slow down, and we need to understand the vaccine and then also do proper studies at our local level to understand the vaccine and the potency as it concerns our people and how we can best protect our people. We shouldn't take the chance yet. That's what I would advise. Of course, it's a welcome idea to have a vaccine for it. And at the same time, we want to be able to understand the concrete treatment for COVID-19 so that we can have less mortality associated with the disease. However, I would advise that we do not rush on any vaccine from Russia, but do our due diligence as a nation and see how well, if it's going to work for us or not.
Before I let you go, because we're absolutely pressed for time, I'm wondering what is happening in Cross River State. I'm not sure we've had any new infections declared very recently by the Nigeria Center for Disease Control.
Well, except for the one case that was found last week, we have actually been doing community testing across our various local government areas, and we have not had positive cases come in to the lab. And for me, it shows a very strong response that have been put up right from the beginning of this pandemic. For the positivity rates to be low and the number of testing to be going up just simply shows that we did our homework well, and Cross Riverians have really supported to adhere to all the guidelines which was given. And we're happy about that development. We'll continue to test. We have our targets, and we'll continue to test until we get to that target. We hope for that day where we'll no longer record any case of COVID-19 in our state. We hope to pick out COVID-19 as we have done to polio in Cross River and in Nigeria.
Dr. Betta, thank you most kindly for speaking with us.
You're welcome.